Hi folks, this is Quyen from SEARAC, the Southeast Asia Resource Action Center. Thanks so much for joining our call today. I'm gonna go ahead and share our screen. Sorry folks, I'm just going to troubleshoot really quickly to see why our PowerPoint isn't showing up. Just bear with us for a couple seconds. Great. Sorry, everyone. Thanks so much for your patience and for joining us today for our conversation around the ACA repeal and what's at stake for Southeast Asian American communities. Again, my name is Quyen. I'm honored to moderate today's discussion. I'm the Executive Director of SEARAC, the Southeast Asia Resource Action Center, and I'm also joined today by Suvan Lee, our Policy Associate, who's going to be offering technical assistance for today's call. And Suvan, do you want to say hi?
Hey, everyone.
Awesome, thank you. Also joining us today will be three colleagues who will be lending their expertise and their analysis to our conversation, including Enric John, Senior Policy Strategist with the Asian and Pacific Islander American Health Forum, Angel Padilla, Health Policy Analyst with the National Immigration Law Center, and Sue Budd, Community Organizer with PICO Center for Health Organizing, a project of the PICO National Network. On behalf of SEARAC and our partners, we thank you for joining today's dialogue. And before we begin, I'd just like to go over some logistics on how participants will be invited to join our discussion today, just in case this is your first time. So first, please be mindful of a couple ground rules that we've set just to create a safe virtual space for us to be in dialogue with three simple rules. One, please respect the points of views that are presented, even if they're different from your own. Secondly, please share your name when beginning. And third, please provide your remarks within 3 minutes, which will allow us to get through as many participants as possible. Secondly, to join us for the discussion portion by phone later, you'll want to enter your unique audio PIN, which is displayed on your GoToWebinar control panel. You'll have to enter this PIN so that we can hear you later on. And as we begin the discussion portion, I'll give more prompts, but go ahead and enter your audio PIN in now if you have that on you. Alternatively, if you feel more comfortable typing in a question, you may do that as well by typing into the chat box, which can be found on the lower right-hand corner of your control panel. And please direct the question to the webinar organizers so that we can help to consolidate and share that information with our panelists. And also a reminder that folks are welcome to send questions to the organizers at any point during the discussion, and we'll prompt you throughout to also remind you to submit questions. And finally, we'll also have polls throughout the conversation today to provide folks with opportunities to engage in our discussion. As a participant, you'll see a window pop up with the polling question, and then we'll give you a set amount of time to respond, and we'll close the poll and share the results live. So to test this function, we're going to go ahead and start with two quick polls, and we're going to have Suvan help us pull that up. And the first question is to ask where folks are joining us from today. and we'll give you about another 20 seconds to respond. If you're from the West Coast, maybe California, Washington, or Oregon, Midwest, Minnesota or Wisconsin, South, like maybe Texas or Florida, or perhaps you're from the East Coast or another coast. And I'll go ahead and close it in about 2 seconds. And it looks like we have a lot of folks from the West Coast today, more than 70%. Most likely a lot of our folks are from California based off of our pre-webinar survey. We also have folks from the Midwest, the South, and the East Coast. So we're really fortunate to have a wide distribution of advocates from across the country today. And for our second poll, we're also interested in knowing how you've been involved with the ACA, as we know that many of you have been longtime advocates. So the question here is to share how you've been involved in the past. Perhaps you are a certified enrollment counselor or navigator. You've advocated for its passage in the past 4 or 5 years. Perhaps you're a concerned community member. And perhaps you're able to obtain new health insurance for yourself or your family. So we'll go ahead and close the poll in just another 3 seconds. And we'll go ahead and close it. Great. And it looks like a large majority of our participants today are really concerned and have been concerned about ACA with its passage as well as the potential repeal. We have some folks who are certified enrollment counselors or navigators who've also advocated for its passage and also benefited from the new options that have occurred as a result of the Affordable Care Act. So that is how the polling will happen throughout the call today. Thanks so much for sharing your feedback in these first 2 calls. And with that, I will transition back to our PowerPoint. And remind folks about the goals for today's call, which is really about sharing information on the current efforts by the Trump administration to repeal the Affordable Care Act, to share analysis and create dialogue around what's at stake for Southeast Asian American communities in particular, especially amidst the attack on immigrant communities, and finally sharing ideas and resources on what we can all do now to organize to protect our communities' access to life-saving health options. And to begin the conversation, we really wanted to frame it around why this is such an important topic for Southeast Asian American communities, particularly for a community that has experienced such historically huge barriers in terms of accessing affordable health insurance and culturally and linguistically appropriate care. Prior to the Affordable Care Act, we know that Southeast Asian Americans experience some of the highest uninsured rates in the nation, and that these rates of uninsured or lack of insurance has really contributed to serious health disparities that we've seen in our communities, where research has shown that, for example, cervical cancer incidence rates are among the highest in the U.S. today for Laotian, Vietnamese, and Cambodian American women, where for the Vietnamese community, the incidence rate is 47.3 per 100,000 individuals, which is 5 times greater than the rate for white women. Additionally, one of the greatest health disparities between Southeast Asians and the general population is liver cancer, 80% of which is caused by chronic hep B virus infection, and liver cancer rates for Vietnamese men are 13 times higher than that of white men. And finally, we know that unique to this refugee community is also the high prevalence of post-traumatic stress disorder, where studies have found that over 60% of the Cambodian community has experienced post-traumatic stress disorder compared to only 3% of the general public. And when the Affordable Care Act was under discussion, these disparities were the reason why SEARAC and our communities advocated tirelessly for its passage as a first step to prevent these disparities from growing. And that across the country, you all have been huge champions as advocates, as enrollment entities, as navigators to help decrease barriers to access across our communities, which is why we know that ACA has decreased uninsured rates from our communities, which Ian will go into a lot more detail about this, but cutting our uninsured rates by half from where we started, from 19% to 8%, and providing access to the most vulnerable in our community, including low-income, recently arrived immigrants and older adults. And that's why we know that now the political repeal of the ACA is a matter of life and death for our communities, and that now is the moment for our communities to continue fighting for our self-determination and well-being by protecting our right to access health care. And with that, I'll go ahead and transition it to our first speaker, Ian John, who is the Senior Policy Strategist for the Asian and Pacific Islander Health Forum, a national health justice organization focused on improving the health and well-being of Asian Americans, Native Hawaiians, and Pacific Islanders living in the U.S. and its territories. Prior to the Health Forum, Ian worked as a policy analyst for the Maryland Office of Minority Health and Health Disparities and at the Department of Health and Mental Hygiene, and as a research consultant for the Loma Linda University School of Public Health in Southern California. And I'll transition it to Ian now, who will provide an overview of the impact of the repeal and what's at stake for our communities.
Thank you, Quyen, and thank you everyone for joining today for this important webinar. Apologies for my voice. I'm trying to overcome a cold, so if I may sound a little stuffed up, but hopefully you all can still understand me. So I'm going to jump right in, and for those of you who are not familiar with the Health Forum, I just wanted to give a brief overview about our organization. We are a health policy and advocacy nonprofit founded 30 years ago. We're celebrating our 30th anniversary. We are based in Oakland, California, with an office in Washington, D.C. And our focus has really been to provide a opportunity, to provide really a voice for our communities and advocacy tools to really improve the health of our communities. And our focus has been really on improving the Affordable Care Act over the last 7 years. We've focused on language access, on access for immigrants, and working closely with CMS and HHS to really improve a lot of the systems. So what's happening now is really of concern to us, and my goal today is just to give you some of the key provisions that are going to really impact Southeast Asian Americans, Native Hawaiians, and Pacific Islanders as well. So hopefully you'll get some good information from what I share with you today. Next slide, please. So as Quyen mentioned, we've really seen a drop in the uninsured rate since the Affordable Care Act was passed. And I just wanted to share some specific numbers within the Southeast Asian community. I have a column with 3 different years. As many of you know, the Affordable Care Act was first passed in 2010. And so I'm sharing some data from 2011, 1 year after the Affordable Care Act was passed, when not all of the provisions had gone into effect yet. There were some things like taxes and being able to have your children covered under your plan until age 26, until under their parents' plan. But some of the real key pieces, such as the health insurance marketplaces which opened in 2013, and then the expansion of Medicaid happened in 2014. So you can see at 2013, those insurance rates were still fairly high. Then if we look 2 years after that, and this is the most recent data that's available from the American Community Survey, we see a real drop because of the expansion of Medicaid, because of the availability of tax credits to the health insurance marketplaces. So you'll see communities, you'll see groups such as Cambodian Americans, Hmong, Vietnamese, where the drop has been over 50%. And that's really been due to the Medicaid expansion and the tax credits. And so a lot of those things are really in jeopardy now, and I'm going to talk about some of those key provisions. Next slide, please. So the ACA Repeal bill, also known as the American Health Care Act, was introduced about 2 weeks ago on March 6th. And I've tried to pull out some of the key provisions, and I'll explain each of these that really will have a big impact on our communities. So one of the key pieces is major changes to the Medicaid program. Because of the changes in the bill, states will receive much less money from the federal government. Basically, states will get an allotted amount based on the number of Medicaid enrollees in the state. And actually, there was an amendment last night to the bill which would allow states to choose a block grant as well. So either way, whether it's a per capita amount or a block grant, it's a fixed amount of money that goes to a state. And what happens is, what it really means is there's going to be much less money going to states, which results in less people eligible, because states will have to reduce who they can cover with the smaller amount of money, and less benefits for Medicaid enrollees. Another piece of under the Medicaid program, one of the changes is that it eliminates essential health benefits for Medicaid programs for those enrolled under Medicaid. So what that means is Medicaid enrollees would not have access to things like mental health, substance use disorder, or preventive services, which they did under the Affordable Care Act, and which many of our communities really were able to use and address some of the health disparities that Quyen mentioned earlier. So that is a really big change as well. Another piece is the elimination of the Prevention and Public Health Fund. This is the first mandatory funding stream focused specifically on improving public health, and it supports various chronic disease prevention programs. It supports the REACH program, which many of you may be familiar with. That's the racial and ethnic approaches to community health, which has really gone towards addressing health inequities. Many community organizations in our communities have been able to access REACH dollars and work on community approaches to improving health, such as things like developing community gardens, walking trails, other healthy eating initiatives. So this fund is completely removed as a result of the repeal bill, and this represents about a 12% cut in the entire CDC budget. Another piece is the removal of the individual mandate, the penalty, the requirement that people pay a fee if you do not have insurance, and it instead replaces it with a requirement to have continuous coverage for at least about 2 months, or an individual could face a 30% penalty on the monthly premium. So if for some reason, and this particularly happens with those individuals where their income fluctuates throughout the year, if there's a month where they can't afford coverage for some reason, if they don't have 2 months of continuous coverage, there's a penalty placed on them, a 30% increase, and so that's really going to impact people's ability to afford coverage. The tax credit, the way the tax credits are provided has been changed. It will now be based on age instead of income. Under the ACA, it was based under your income level, and so that's going to be changed to be based on age. So younger, people like, for example, those under 30 would receive about a $2,000 credit, going up to $4,000 for those who are 60 and over. And what this means is, it's going to really impact older Americans with lower incomes, because the cost of their care would be more, but they're not going to get as much in the form of the tax credit, and their coverage is going to be more expensive, but they're not going to get as much help. And so it's really going to impact lower income individuals, particularly those that are older, and so we really see that as a big challenge. The tax credits under the ACA were also available to all lawfully present individuals under this repeal bill. That definition is changed to qualified immigrants, which will cover a lot less people, a lot less categories of immigrants, and Angel's going to talk more about that, so I won't say much more about that. And then finally, another provision that I wanted to highlight was a decrease in access to women's health care services. So one of the things, what the bill does is repeals the contraceptive benefit tax, which allowed women to have access to contraceptives with no out-of-pocket costs. That was under the ACA. It also defunds the largest family planning provider in Planned Parenthood that provided, many reproductive health care services such as breast cancer screenings, screenings for sexually transmitted infections to millions of low-income women, many for whom this was their only accessible provider. So, there's other provisions as well, but these are some of the key ones that I wanted to highlight and make sure that you are aware of that would really impact our communities. Overall, basically this plan is not good for those who are older and poorer, and for those who live in areas where care is expensive. You know, it's good for those with higher incomes and younger income people, but overall it's going to really impact our communities. Just a correction on this slide, it should be the CBO analysis. Our organization is involved in another effort with the Office of Management and Budget, so I mistakenly put OMB up there, but this should be the Congressional Budget Office analysis. That's the office that did basically looks and sees what the cost effect is of this bill. And this analysis actually came out about a week after the bill was introduced, after it had been already voted through 2 of the House committees. And really quickly, some of the financial impact that this bill would have, financial and other numerical impacts that this bill would have. 24 million people would be uninsured by 2026. And so basically 20% of the US population under 65 would be uninsured. Today that's about 10%. So you can really see some of those drops in the uninsured rate for Southeast Asians, and Asian Americans, Native Hawaiians, Pacific Islanders. Those rates are going to increase again because some of our groups are going to be the ones hardest hit because of the changes in Medicaid and tax credits that I mentioned earlier. There will be huge cuts to Medicaid, $880 billion over 10 years. In California, it's about a $20 billion cut, which accounts for about 1/5 of Medi-Cal funds. So a huge cut to California. Which provides coverage to 14 million less people will be covered by Medicaid in 2026 due to these changes. Premiums would also increase, according to the OMB analysis, by about 15 to 20%, but even higher for those that are in their early 60s. Next slide. So I wanted to also mention specifically the impact on Asian Americans and Native Hawaiians and Pacific Islanders. 2 million Asian Americans, Native Hawaiians, Pacific Islanders are at risk of losing their coverage. We know that a large number of our population are enrolled in Medicaid, and you can see the percentages there across the country. If you look at California, I know we have many Californians on the call, so the AAPI Medi-Cal enrollees in California have more than doubled since 2013. And so that's a real big impact that this bill would have with the reduction in Medi-Cal funds. And Medicaid has been important because it's allowed our populations to have access to treatment for conditions such as certain cancers, diabetes, hepatitis, which our communities suffer from at a higher rate than other communities. 8 in 10 Asian Americans and Native Hawaiians Pacific Islanders have qualified for financial assistance under the ACA. That will be put in jeopardy because less of our communities will be able to take advantage of the tax credits due to some of the changes in immigrant access, as well as the changes in Medicaid eligibility that will result from the decreases to Medicaid funding. So I just wanted to, hopefully this has been helpful, just highlighting some of the key provisions. I wanted to quickly give a timeline to you all as a sense of what's happening in Congress now with the bill. Basically, the House of Representatives is expected to have a full vote on the bill on Thursday, tomorrow, or actually on Thursday in 2 days, which is actually the 7th anniversary that the Affordable Care Act was passed. A couple of amendments were made last night, and I didn't mention those, but I'll quickly mention that one of the amendments was allowing states to add a work requirement to Medicaid for adults who are able to work. So if you're on Medicaid, you have to work, and then also extra funding for seniors tax credits, but it doesn't actually add any money for that. They're allowing the Senate to add in some extra dollars for those who are older and would have higher costs. So the plan is to have this bill voted on on Thursday by the House. From there, it would probably go, it would most likely pass the House the way that it looks right now, and then move on to the Senate. As you may know, the Senate margin for Republicans to Democrats is slightly slimmer, so there's 52 Republicans to 48 Democrats. Many senators have expressed concerns about the bill, and so there still may be, there may be challenges. We expect more changes to be made to the bill. And the ultimate goal is to have the Senate approve the bill and have the bill go to President Trump's desk by April the 10th for his signature, which is the first day of the legislative recess when the Congress goes out of session for about 2 weeks. So that's just briefly what the timeline looks like. I'm sure you will all see many messages from the Health Forum and other organizations over the next couple of days to take action and to contact your congressional representatives, and I hope you all are able to get involved. I know Sue is going to talk about some other ways to get involved. So hopefully that's been helpful, and I'll pass it back over to Quyen.
Great, thanks so much, Ian. And before we go into a poll, we actually had a question from one of our participants, a clarification question on whether the AHCA would repeal the Affordable Care Act.
Yes, so the AHCA is basically the replacement plan for the Affordable Care Act. So it takes away most of the provisions of the Affordable Care Act and replaces it with new, different provisions. So yes, it is essentially a repeal of the Affordable Care Act.
Great, thanks so much. Before we transition into our next speaker, we want to thank Ian again for providing us with information on where the legislative fight is and where our advocacy efforts are going to be really important. And before we transition to Angel, we'll go ahead and pause for a poll just to get feedback from participants so far. And the question is, would you or someone you know be impacted by these repeal efforts? And we'll leave the poll open probably to another 15 seconds. And we'll just give 2 more seconds, any last votes, and we'll go ahead and close it out and share the results. So it looks like overwhelmingly 85% combined of folks joining us for today's call will be impacted either through their family or other communities. And there are some folks who won't be directly, but are concerned about the future consequences. So we really thank you for sharing that impact, and we'll really be processing a little bit more what we can do to protect our communities. And with that, I will pull it back up, my PowerPoint. Oops. And go ahead and transition to Angel Padilla, a health policy analyst with the National Immigration Law Center. Angel will help to provide us with context on how these proposals are really going to impact immigrant communities, particularly those with differing immigration statuses. Angel works closely with NILC on other health on developing and implementing NILC's federal immigrant health policy agenda. Prior to joining NILC in February 2014, he was an immigration policy consultant at National Council of La Raza, and before that he was a legislative assistant for Representative Luis Gutierrez, advising on issues related to health care and the Affordable Care Act, among others. So I'll go ahead and transition it to you, Angel.
Hi, thank you. So let me just, hi everyone. Let me just first begin by a little bit of what the goal is here. You know, the goal here is really to show how this new plan, this replacement plan, is going to impact specific categories of immigrants. And in order to do that, we sort of need to take a step back and establish a baseline understanding of what the eligibility rules are for immigrants for different programs. So I'm going to quickly go through the rules for Medicaid, CHIP, and the Affordable Care Act as they exist now. And this will be sort of important as we think and talk through what this replacement bill would do. And then finally, I'm also going to quickly talk about how all of this noise, all of these anti-immigrant policies that we're seeing and that we're hearing about have affected immigrant communities. Next slide. Right. So most people think of immigration status as basically in two terms. The first is undocumented, and the other one is basically lawfully present. And this is an important distinction because this new bill really does take us back a few years in terms of eligibility for immigrants. Generally speaking, when someone says undocumented, that means that they are not authorized to be in the U.S. And when we talk about lawfully present, that means that they are federally authorized to be in the U.S. Now, if you are lawfully present, that means that you can have one of a number, literally dozens of immigration categories. But it basically, again, just means that you have authorization by the U.S. government to be in the United States. There are about 11 million people who are undocumented, and a lot of them, some of them entered without inspection, but many, almost half, entered through a visa. So it's a very different mix of people who, in the way that they actually came to the U.S. Next slide. Right. And so a person's particular immigration status really does have implications for the kinds of programs that they can access. In the next few slides, I'm going to go over the general eligibility rules for Medicaid, CHIP, and the Affordable Care Act. Again, this is not an exhaustive list. This is sort of a big picture overview of what it looks like. I'm also going to breeze through some of these, and I suggest people come back and look at the list because it's a long list of statuses. And then also something I want to quickly note is that if someone's status is not listed in the slides coming up, and they're not eligible for Medicaid, CHIP, or the ACA, that doesn't mean that they don't have options. There are other opportunities to access healthcare, like community health centers, like clinics, and there are a ton of local programs at the county level, at the city level, that are options for immigrants. Next slide, please. Okay, great. The sort of starting off point is the 1996 welfare law. In 1996, Congress and President Bill Clinton signed welfare reform, and it contained a list of categories that would be eligible for federally means-tested programs, including Medicaid and then later CHIP. Basically, the 1996 welfare law created these categories of deserving and undeserving immigrants, and according to the law, if you were deserving, then you were considered a qualified immigrant. This list here contains those immigration statuses that are considered qualified, i.e. deserving of health care. And so if you have one of these statuses, you are eligible for Medicaid and CHIP. So the biggest one here is the green card holder, LPR. But there are also some other ones that might be familiar to you, like refugees and asylees, and there's also some that might not be that familiar to some of you, like battered spouses, child and parents. Next slide, please. There are also a couple of other categories here that were also that are also considered qualified immigrants for purposes of Medicaid and CHIP, and these are, if you're a member of a federally recognized Indian tribe, or these other two categories here. I think the bottom line here, the thing to remember is that if you have one of these qualified immigrants, then you have access to Medicaid and CHIP. But there's also a different complication. Next slide, please. So even if you are one of these qualified immigrants, even if the 1996 welfare law said that, yes, you deserve health care, for a lot of these categories, it also created a waiting period. For a lot of these categories, you have to wait 5 years before you have access to Medicaid, to CHIP, and other programs. Again, so it includes green card holders. So green card holders are the biggest group. Green card holders are the ones who are one step from becoming a U.S. citizen. But generally speaking, if you are a green card holder, you have to wait 5 years before you can access Medicaid and CHIP. So it's a big deal. It's been one of the biggest barriers for accessing healthcare. But there are some categories of immigrants that are not subject. Oh, I'm sorry. Yep. Next slide, please. I'm sorry. Oh, wait, I'm sorry. I think I may have skipped one. No, this is it. I'm sorry. So there are certain categories that are not subject to the 5-year waiting period. And so, for example, refugees and asylees are not subject to the waiting period. And that is simply because the idea is that if you are a refugee or an asylee, you come to the U.S. with basically nothing, with the clothes on your back. And so this idea that you have to wait for certain programs just doesn't make sense. And that's why in the 1996 welfare law, it exempted that law exempted certain categories, so like refugees and asylees. There are also some state options. So CHIPRA, the CHIP Reauthorization Act from 2009, created a state option that has allowed some states to provide access to some of these groups, some of these immigrants, without a waiting period. So there, it's a complicated mix of programs and eligibility. Great. Next slide. So the Affordable Care Act, March 2010. It's the 7th anniversary this Thursday, the same day that they're voting to repeal it. Next slide. The ACA made huge gains for immigrants in their access to healthcare. A lot of the categories of immigrants that are not eligible for Medicaid and CHIP are eligible for the ACA. Not all, though. For example, undocumented immigrants are still left out, and also DACA, persons with deferred action for childhood arrivals, are also left out. But generally speaking, it uses the standard of lawfully present. And that, again, going back to the beginning, lawfully present is those folks who are federally authorized to be in the United States. Next slide. Okay, great. So look, this is a big list. I'm not going to go through all of them, but I put this in here to show basically how it's different between the old 1996 Medicaid rules and the ACA rules. The ACA, again, uses the standard of lawfully present, and that includes the different categories on the left, and they should look familiar because those are the qualified statuses for Medicaid and CHIP. So it includes that list of statuses, but then it also includes this other group of immigrants, all of the ones on the right. So these are folks on the right here who are, again, authorized to be in the United States, but they're not eligible for Medicaid and CHIP, and so they are eligible for the Affordable Care Act. Some of these might sound familiar to you, some of you. One of the biggest ones here is those with TPS, temporary protected status. Those are individuals in the United States that have been allowed to stay here because it's not safe to return to their home country. It might be for political reasons, like it's just not safe to go back to their country. It might be because of an environmental disaster and they just can't go back because it's, again, not safe to go back. So some of the biggest here in DC, where I live, some of the biggest groups of TPS holders are those from Central America because of some of the violence in Central America. So again, these are categories. These are new categories that were made eligible through the ACA. Next slide. What's also important in the ACA is that you also can be an applicant for a status. You don't actually have to have a status and still be eligible for ACA coverage. So if you, for example, are applying to become a green card holder and you have an approved visa petition, you are eligible for ACA. The point here is that the ACA really expanded access for a lot of new immigrants that weren't eligible for Medicaid or CHIP. The fact that some people who are applying for a status that they're eligible is sort of an indication of how broad eligibility rules are under the ACA. Again, not everyone's included, but it's definitely a step forward from the Medicaid and CHIP rules. Next slide, please. Okay, so now Ian talked a little bit about how this is likely to change under the GLP plan. Basically, it would take us back to those old 1996 welfare law rules. So all of those new statuses that we just went through, like the TPS, the ones on the right, the applicants for different statuses, all of those would be immediately ineligible for the new program if it's passed. So what that means is basically, all of these immigrants who are here, who are authorized to live and work in the United States, who have access now, would lose it under this plan. So it's a big deal for immigrants. Next slide. Great. So just wanted to quickly touch on something else that's really important, and that's that what we're seeing from this administration and from Congress are a number of anti-immigrant policies. It's not just in terms of healthcare, even though the GOP replacement plan would reduce access to immigrants, but it's also in terms of the Muslim ban, the expanded internal enforcement actions, It's also a leaked executive order that I'm not going to get into, but that was, that it has implication for immigrant communities. Basically, what we're seeing is that immigrant families are afraid. We're hearing from families that they're not going to the doctor, that they're disenrolling in programs that they're eligible for because they're afraid that if they use those programs, they're going to get deported, or someone else from their family is going to get deported. So we're hearing a lot of that, and what we've been trying to tell people is that at this point, even though there's a lot of uncertainty about what's coming down the line, at this point nothing has changed. And so if you need to go to the doctor, you should go to the doctor. If you are in a program, you should keep your program. I mean, if you're enrolled in Medicaid, disenrolling is not going to affect you at this point. Nothing has changed, and so what we're saying is go to the doctor if you need to, and also look up. There are a lot of materials out there on Know Your Rights. If you have questions, for example, NILC, National Immigration Law Center, does have a page dedicated to providing Know Your Rights materials to consumers and community members. So that's what I would suggest. That's what I had. Again, immigration statuses and eligibility for healthcare programs is super complicated. I went big picture here, but if there are questions, I'm happy to answer them, and also happy to take questions offline.
Great, thanks so much, Angel. I think I try to think about how the ACA or the repeal efforts are going to impact our constituencies at large, and it really seems like there are a lot of trends in terms of losing your benefits and also increasing the costs to what we currently have access to. So with that, I think we'll actually just pause for a quick poll to get feedback from participants around what you all see as being the biggest threats that you're concerned about for yourself or for your community. And we'll go ahead and keep this open for another 15 seconds. And we'll go ahead and close the poll and share the results. And it looks like we are concerned about all of the above, including Medicaid and Medicare preventions and the costs, the increased costs, and also the loss of benefits that would result from these proposals. And to round out our presentation, we'll go ahead and transition to Sue Budd to share how the PICO Center for Health Organizing has really been thinking about advocacy and community building and community advocacy and protection of these really important healthcare provisions. Because we're short on time, I'm going to go ahead and transition it straight over to Sue.
Well, thank you, Quyen. I'm glad to be here today, and I learned a bit just now from the other presentation, so that's great. My name is Sue Budd. I'm with the PICO Center for Health Organizing. PICO actually started out in California, so maybe some of the West Coast attendees are familiar with us. We are a multiracial, multi-denominational, faith-based network throughout the U.S. We're comprised of 45 different organizations in various states, and the members within those organizations are congregations, churches, synagogues, temples, and our core focus is on racial and economic justice. So that's kind of a sense of what we're about. Although some of what I just heard about deserving and undeserving people goes so against my faith-based beliefs that we're all children of God that are deserving, I wanted to say a few things about some things that are going in our favor right now. As most people on the call probably know, the goal was to have a repeal act on the new president's desk on his first day in office, and that did not happen. And one of the reasons that did not happen, I am very convinced, is because of all the community organizing that went on throughout the nation. We started, obviously not just PICO, several organizations started organizing back in December, and when the recess started before the end of the year holidays. So on December 20th, there were actions across many members of Congress, home offices, and we it was heard loud and clear that that this wasn't just going to pass without the public taking notice and without more visibility about what was actually going on. So one of the things that PICO did is worked with a coalition, that put together these reports called A Cost Too High. And what that did is it looked even beyond just the healthcare costs and some of the analysis that we've had so far into this call into other impacts. So, for example, on the slide, you see the numbers that were in this report from Minnesota, which is where we're actually, the Center for Health Organizing is part of PICO, but we are actually headquartered in Minnesota, so I chose to use these numbers. But so for each resident in Minnesota, it has an impact of, the repeal of the Affordable Care Act has an impact of $3,500 a year. But in addition to that, it has huge impacts in terms of the numbers of jobs that will be lost, the cost to doctors and hospitals. A lot of especially our rural hospitals, are very dependent on the Medicaid expansion that took place, and other programs within the Affordable Care Act, and the loss in federal dollars are huge at a state level. So what we did is we produced these reports state by state, and then we held press conferences to release them. So this is actually what we were doing during that recess period at the end of December. So it got a lot of press, a lot of attention by elected officials, and a lot of visibility. So it was a very key tool that we used. Now, since then, with the new act that was introduced March 6th, as well as just the ability to produce more and more numbers, there's a lot more information out now around the impact. I think, Quinn, you mentioned that this really is a matter of life and death, and the latest report I just saw actually has projections on the estimated impact of annual death rates by state. For example, California, the estimates in the low end of the estimates are that it will result in 3,200 more people dying in a year than if we had the act, and the high end, it's up to 11,000 more deaths that are a result of not having the support that is so needed for people to be healthy. So anyway, there's a lot of statistics almost any way you want to look at them, but they are very very revealing, I guess, is the word I'll use. So let's go ahead to the next slide. So as organizers, here's some of the stuff that we're looking at as for our strategies and actions. Firstly, it's important to note the opposition strategy. Secrecy is a huge element there. Even with last night's vote on the management plan, I think they're calling it, or these additional pieces that they added to the act to make it more restrictive to gain a few more votes. So secrecy has been a key element, and rushing it through has been another key strategy that they're trying to use. So the ways that they're most vulnerable right now, from our assessment, is that that there's huge tax breaks to the very rich, and exposing those tax breaks is a vulnerability. There are also rules that they're disregarding, and some of our democratic process that's being overlooked, and that is another key point that we can organize around, because we have faith in democracy, and democracy is a key element of the survival of this nation as we know it. So those are two vulnerabilities that we focus on. How are we actually getting visibility? Our biggest weapon is visibility, and there's a number of ways to gain that, and I think probably everyone on this call has seen pieces of this in the media, or even as you're driving through town and see people on street corners or at public office buildings. But just on this list, I wanted to mention a few. So definitely taking action at the members of Congress's offices. Here in Minnesota, we have three conservative House members that we believe can be influenced, and so we go to their offices and try to make an appointment. If they don't make an appointment, we just make sure that we're seen and heard from outside the office. So that's one strategy. Another is to hold town meetings, and lately a lot of them have been empty chair meetings. That means that although the member of Congress is invited by hundreds or sometimes thousands of constituents to attend the town hall meeting, they increasingly are not showing up to them. And so we don't just not hold the meeting, we hold the meeting and call it an empty chair session, and discuss the issues for everyone present. And obviously don't hear any response from the people that we've elected to represent us. So recess time is an important time to pay attention. I think Ian covered the timeline earlier and said that that this will probably pass the House this Thursday, we're expecting, on the anniversary, and then we're also expecting it to try with strong attempts to get it out of the Senate, to pass the Senate by the next recess, which I think means April 8th, I think is that day that they actually go on recess. So, or the 7th. So that's another key time frame for us to be paying attention. They want this passed before they come home for that recess, to thwart some of the reaction, and of course we are hoping that we can delay it even further. The anniversary, 7th anniversary, is this week, this Thursday, so we've got events planned in multiple states for that. Those might be press conferences, they might be, I don't know that we have town hall meetings this Thursday, but mostly press conferences and rallies and protests of that sort. There's been some actions at hospitals that are at risk. I mean, obviously we aren't going into hospitals and disrupting care that's given, but we are being visible around hospitals that are at risk of closing their doors. And there's several of them right here in the Twin Cities in Minnesota that I know of, and many in rural areas throughout the nation. So we always encourage letters to the editor. They are really effective for being heard in your local communities. A lot of people are out there believing, on the fence. They're very influenced by what they hear from their community members, and letters to the editor is a great way to do that. You don't have to be an expert. You don't have to throw statistics out there. You can tell a story of someone you know or yourself, and that often is more impactful than all the statistics in the world. So we do that a lot. We do a lot of training and have toolkits around letters to the editor writing and op-eds, and so we're doing a lot of that. And then phone calling is where members of Congress hear from their constituents themselves, and it carries so much weight when you take the time to do that. They do pay attention, even if you don't ever speak directly to them. If you speak to their legal aides, or if you leave a voicemail message for them, all of those things impact and allow them to weigh how successful or unsuccessful they're going to be based on which way they're leaning. So even if it's phone calls thanking people, we're going to be doing a lot of phone calling on this Friday, depending on what actually happens on Thursday, thanking people for what they did, or not, or voicing our objection to how they voted, and letting them know that they are being watched and are responsible to answer to their constituents. So that's kind of just a laundry list of the kinds of organizing and strategies that we're using right now within our network. So I hope that that's helpful. Let's jump to the next slide. This is, some of you may have seen this. I think earlier we heard someone refer to the Congressional Budget Office that came out with their analysis just recently, and I thought this slide depicted things very well. I'm a graphics person, so I like to see things visually, and basically net is there's $1.2 trillion in reduced benefits. We heard specifically how those are going to hit immigrant communities so much more than the general public, and in addition to that, there's $861 billion in tax cuts. One of the statistics I've heard most recently is that the 400 richest people in the United States will actually have tax reductions of $7 million each per year, which is like, wow. So it just is really not the direction that we within the network believe we're called to take, and that's why I'm happy to be here today to share those comments and thoughts with you all. So thank you.
Great, thank you so much, Sue. I really appreciate the exhaustive list of ideas and actions that are going on with the PICO network. And as we start to close out, we'll go ahead and just share out some of SEARAC's larger strategies around the repeal efforts, really centering our focus around community engagement and maintaining our monthly calls, and also doing additional listening sessions and town halls throughout the country to really hear about what's happening in our communities. We're staying our course in terms of building powerful leaders and advocates. We have our leadership and advocacy training 3-day program happening June 26th to 28th, just kidding. And we'll be focused on immigration, but while we are advocating for immigration reform, we're also mindful of how immigrants will directly be impacted by these health care proposals as well. We're also leading some coordinated communications work to uplift the experiences of our community members who will really see attacks to their families and access to care based off of these repeals. We're launching an Affordable Care Act Protection Comment Card campaign. We're hoping to collect 500 comments by the end of April. There's a link here to an online form if folks would like to distribute that as an action. And we will also be releasing a toolkit in the next couple of weeks with printed comment cards that we'll be able to share with the community as well. We are also really mindful of ways that we can continue community mobilization efforts that are going on across the country, perhaps inspired by or in conjunction with or in partnership with other organizers and partners from across the country. And together with our partners, including Health Forum, NILC, and PICO, we're also going to continue advocating on behalf of Southeast Asian American communities by bringing the stories of how we're going to be impacted directly to leaders on Capitol Hill. And to give a summary, this is just a summary sheet again of what folks can do. And as we close out, there are some questions for our panelists. The first one is for Angel. And the question is how asylees, refugees, or long-term permanent residents with criminal records or pending criminal proceedings, how those folks will be affected.
So, I mean, that's a good question, and because there's two sides to that, there are a lot of issues generally on the immigration enforcement side about this like people with criminal records, because there has been this emphasis, at least from what the administration is saying, on people that they want to go after. From what we've seen from the executive orders and their plans, there really is no priority. They're really just going after their whole purpose right now is to try to scare families and try to go after anyone they can, and they're not really making distinctions about different kind of priorities of people. But in terms of eligibility for healthcare, I mean that doesn't go as far as I've seen, that's not something that's considered, at least not, it hasn't been in the ACA or Medicaid or CHIP. It's basically if you're otherwise eligible in terms of like income, And then also, if you have an eligible immigration status, you could have an eligible immigration status, for example, have a criminal record and still get access to the ACA. So I haven't seen anything like that in the new bill, but it's hard to say. I don't expect it to be an issue though. And I don't know, maybe Ian, if you have any other thoughts on that, you might know a little bit more.
No, I don't have anything else to add on that, Angel. Thanks.
Great. Thanks, Angel. Thanks, Ian. And maybe if we have additional analysis on that point, we'll be sure to send that out to our participants from today's call and continue to track that issue. The next question I think would be best for Ian. This question is from Tina, and the question is, would it be possible to speak more about EHBs and Medicaid being eliminated? And I'm not quite sure what EHB refers to, but you might.
Right, so that's the essential health benefits. So under the ACA, all plans that were in the marketplace were required to have essential health benefits. And the repeal bill doesn't change any of that. What it does change specifically is to remove this from the Medicaid. So those who are covered under Medicaid would not have access to some of the essential health benefits. There was a series of, I think it's 10 different categories of things that were covered under the ACA. So it doesn't change anything for those who purchase plans through the marketplace. What it does change is for those who are on Medicaid, it takes away those essential health benefits for those on Medicaid. And I mentioned some of the things like access to mental health services, preventive care services. Those things would be eliminated for those who are on Medicaid in this bill.
Great, thanks so much, Ian. And assuming that the GoToWebinar does not kick us off because we're over time, we'll go ahead and just spend maybe another 3 minutes on one final question, which would be great for Sue because it's about organizing, and then we'll end with some polls and reminders. The question is from Van Sam, and the question is, what are some things that youth or college students can do in terms of advocacy within our families and our communities?
That's a really good question because youth organizing is wonderful. It has such high energy usually. Let me think of if I specifically have any recommendations. I mean, there's education and visibility of the impact is really important. So spreading the word via youth and youth organizing to get into families that are impacted is a really powerful tool. I don't specifically. That's about as much of a idea as I'm coming up with right away. So I'd say the more you can do with youth organizing around it, all the better. But I don't have anything specific to that I've seen done most recently.
And Ian or Angel, would either of you like to add on to those recommendations or insights?
Yeah, I mean, this is Ian. I think there's an organization called Young Invincibles, and there may be some ideas from their. I don't know how much information is on their website, but I know they do a lot of mobilization activities focused on youth and using social media. So that might be an area to look up some ideas. Young Invincibles.
And I think also leveraging your student organizations as a place to also educate students and getting the word out to your families as well is also a really powerful network. And I think we'll go ahead and remember to share out a couple of resources from our presenters. So from SEARAC, we have our Health Policy Resource Hub and also access to our online comment link. After this webinar is completed, you'll get a link to the PowerPoint as well as the recorded webinar. So the hyperlink will be active in there. And then Ian, did you want to share about some of the resources here, and then we'll go to Sue and then Angel?
Yeah, so really briefly, the Kaiser Family Foundation has a really good summary of the ACA Repeal bill or the AHCA if you want more details about what's in there. They're also on their main Kaiser Family Foundation page. There's an actual tool where you can compare tax credits under the ACA versus the repeal bill at the county level. So that's kind of interesting to see what the specific impact is. We've also created a series of 5 infographics specifically on how the repeal bill would impact Asian Americans and Native Hawaiians and Pacific Islanders. So that's what that link is to.
I know from PICO, the other state reports are Colorado, Louisiana, Missouri, Indiana, Alabama, Minnesota, Ohio, and Missouri. I do have access to that, and I know that Sue does too, so please feel free to reach out to us. And Angel referred to NILC's information on their healthcare website, which also includes really great toolkits and know your rights, particularly for immigrants, and health resources that folks should still be accessing. We'll go ahead and skip the discussion and end with a couple polls, or one poll for folks who might still be with us. And I think we'll like to close out on action. Sorry, we're just going to pull that up one more time. Okay, let's do a different poll if that one's not working. How about, what action would you like more resources or support in implementing or learning more about? And so we've listed here some of the ideas that were presented on the webinar, including hosting a town hall, joining social media campaigns, meeting with legislators, like letters to the editor or op-eds, phone calls. And we'll go ahead and just give folks another 5 seconds to weigh in. And we'll go ahead and close the poll. And it looks like folks are interested in learning more about social media campaigns and actions, as well as letters to the editor, town halls, and meetings with policymakers. We'll certainly keep this in mind as we create our next webinar, potentially focused more on strategy, especially around organizing and action now that we have some of the policy landscape down. And I think with that, we will go ahead and close out with just a couple reminders on our next call, which is going to be April 18th. If folks have any questions related to our specific discussion today, please feel free to reach us via email, which is displayed on the thank you screen. And then as a reminder, you'll be receiving a survey once this webinar is complete, and we'd really love to encourage you to fill that out so that we can improve future webinars and calls to make sure that we're meeting the needs of our partners. And we wish you luck around the organizing that folks are already planning on doing, and encourage you to reach out to us to share how those actions have been going. Thanks everyone, and happy Tuesday.